For the purpose of this assignment, the co-presenters will debate the topic of pets in early childhood setting. The Canadian Pediatric Society notes that pets are good for people. They provide joy, can help improve our health, and help teach children values and social skills. But some pets can carry diseases or may be dangerous for young children. This debate will examine both the benefits and potential risks of caring or inviting a pet into an early childhood setting.
This is my debate for having pets in the early childhood setting. According to the Journal of the American Board of Family Medicine, pet is the term of endearment reflecting the bond people have with their companion animals. The relationship children have with pets help develop skills such as nurturing, self-worth, responsibility, empathy, self-esteem, improved communication and social skills, and a higher immunity to fight off infection. The benefits of pets in the early childhood environment will be further examined, including animals that are suitable to this environment, mitigating the risks involved with classroom pets, and the positive impact of pets on health, ZooEA. This is my first argument to support pets in the early childhood setting. When close relationships between pets and children are formed, it is a bond that can have a significant impact on a child's psychosocial development. Goldman shares studies from the Oregon State University that preschool children from single-parent families, children without siblings, or children that are difficult to reach can successfully integrate with their peers and enhance their social skills when caring for a pet. The study revealed that having a pet improves children's role-taking skills because they have to put themselves in the pet's position and try to feel how the pet feels, and that transfers to how other kids feel. Children with pets demonstrate enhanced empathy, self-esteem, cognitive development, and greater participation in social and athletic activities. They exhibit increased trust, community feeling, sense of safety, and self-confidence. In a classroom setting, children observe and learn to care for their pet, instilling a sense of responsibility and respect for life, developing greater empathy. When children successfully nurture a pet, their sense of pride and accomplishment boosts their confidence. They become intrinsically motivated to learn and make new discoveries. An important component of a child's development, as described in How Does Learning Happen?, is their ability to self-regulate, or their ability to deal effectively with stressors and then recover. Pets support children's developing ability to self-regulate, enabling them to become calm and focused. Research has shown that 40% of children turn to pets for emotional well-being when they are feeling tired, upset, anxious, scared, or lonely. The unconditional warmth received from a pet is rewarding and builds reciprocity. This is my second argument to support pets in the early childhood setting. In the guidance document for the management of animals in child care, the Ministry of Health and Long-Term Care lists the animals not recommended for any child care centers and for those children under the age of 5. While the list excludes the more popular domesticated pets, cats and dogs, animals that may be more suitable for child care settings may include goldfish, hamsters, guinea pigs, chinchillas, hermit crabs, and stick insects. While some of these pets have not been domesticated, children can still develop strong bonds with them. Educators and children need to consider pets that are low maintenance and that can be left safely overnight and on weekends. Choosing the right pet for the classroom will require following the infection prevention and control recommendations section and consulting parents, informing them of the benefits of engaging and interacting with animals, as well as the risks, allergies, phobias, and how the child care center plans to mitigate those risks. These include but are not limited to hand washing, food safety, cleaning and disinfecting, and monitoring. The human-animal bond in a classroom environment stimulates learning and is a wonderful resource for educators. A new way for children to learn scaffolds academic development. When children are asked questions about the pet's weight, the pet's eating and sleeping habits, or to use words to describe the pet, they are challenged to use their math, science, and grammar skills. Physically, fine and gross motor skills can be developed while feeding the pet, handling and playing with the pet, and cleaning their habitat. Pets in the classroom experience provide an opportunity for kids with no exposure to animals in their home environment to see, feel, touch, and make connections to the wide world of animals. Collaboration between educators, parents, and children, the sharing of information, and resources such as grant funding for pets in the classroom can make this a successful and rewarding experience. This is my final argument to support pets in the early childhood setting. In 1948, the World Health Organization defined health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Injury or disease resulting from the suitable classroom pets mentioned earlier would be considered a preventable, non-infectious concern. Zooeia is a term to describe the human health benefits of companion animals. It is the positive inverse of zoonosis, or disease. When children seek out pet companionship, it affects their well-being by reducing blood pressure, heart rate, and behavioral distress. Although there is strong evidence to show children caring for pets improves school attendance, with fewer sick days, and children from families with pets having a better chance of fighting infection than their pet-free counterparts, future studies are necessary to measure these connections. The age of a child and the type of pet they are first exposed to may be contributing factors to allergies and asthma. The hygiene hypothesis supports that children with dogs or cats in their home during their first year of life are less likely to develop allergies in childhood. McNicholas, a British psychologist, believes that although health risks associated with pets should not be de-emphasized, they can often be overstated. In some cases, simple measures can overcome fears of problems associated with pet ownership, so that the pets vastly outweigh the potential problems.
All right, I'm going to be arguing against pets in early childhood settings. Pimento and Kierenstead share the recommendations of the Canadian Pediatric Society that pets should not be a part of early childhood programs. They note the reasons for this standpoint, saying diseases can be passed from animals to us and can pose issues for children, parents, and staff with allergies or weakened immune systems, or pregnant staff or parents. The issues of caring for pets in early childhood settings will be further discussed, outlining and stressing the potential risks involved, in addition to the significant preparation and maintenance concerns that arise with such an initiative. The first point that I'm going to address is preparation and maintenance. Pets and animals, whether visiting or resident in a facility, require significant preparation, maintenance, supervision, and staff awareness in order for this type of experience to be safe and successful. To begin, inviting family pets or animals from local organizations into a childcare facility involves an inherent level of risk, as the health and well-being of the visiting animal is essentially unknown. The Ministry of Health and Long-Term Care notes that the child care center operators and staff should exercise extreme caution when inviting animal exhibits into their center, as licensing and regulation of such exhibits is extremely limited. The Ministry also advises the completion of a veterinary care statement for animals visiting child care centers, a form which is located in their document, to confirm the health of the visiting animal and to outline certain stipulations, such as ensuring that none of the visiting animals have been fed raw foods 90 days prior to the visit. The preparation involved to welcome a pet into your program is incredibly extensive. In the guidance document for the management of animals in child care centers, the Ministry of Health and Long-Term Care outlines specific, detailed steps involved in preparing your facility for the arrival and care of an animal. Extensive planning and detailed organization is required in order to meet the guidelines as set out by the Ministry, including the preparation of the facility for infection prevention, discussion with families, establishing documentation procedures, consultations with the local public health unit, and the education and training of all staff, volunteers, students, and the children. Furthermore, despite the undertaking of strict cleaning and disinfecting practices, as well as the intent to fully supervise all interactions and experiences with the animals before, during, and after contact, following these policies will still not guarantee all risk will be eliminated. The maintenance and care essential to having a pet involves a considerable amount of commitment and dedication on the part of the facility staff. In her article, Keeping Pets in Childcare, Peters brings up a number of questions for staff to consider, and I'm just going to go through a few of them. Who will pay for the care and upkeep of the animal, including feeding, health care, and cleaning? How will the pet be cared for on weekends and during service closure periods? What physical space is available? Is it adequate for the pet you're thinking of? Are all educators and families happy with this decision to get a pet? What time will be available throughout the day to care for the pet, or will educators be asked to give up some personal time to do this? Are there any children or educators at your service who are allergic to or have phobias of animals? And what changes to your services, policies, and procedures need to be considered? For example, your hand washing policy will need to be updated to include washing hands after having contact with the pet. Childcare facilities need to determine if they're willing and able to take on the task of welcoming pets and animals into their facility and be prepared to accept many and varied additional responsibilities as a result of this practice. My second argument to support the against position has to deal with allergies, asthma, phobias, and injury. Pimento and Kierenstead outline some common allergens that early childhood educators may come into contact with when handling animals, such as dander, skin flakes, saliva, and urine. Typically, reactions are not generally serious. However, that's not to say that this cannot lead to something of a more serious nature. With a significant rise in children and adults who may have an allergy or suffer from asthmatic conditions, we need to be cognizant of these conditions and work to ensure that we do what we can to avoid triggers. It's also worth noting that care also needs to be taken with children who have food allergies, as some pet foods contain common allergens such as nuts and seafood, which is of concern. Attention to the storing of pet food will be necessary in order to avoid the risk of anaphylactic shock. The overall well-being of the child should be considered, as allergic reactions can cause feelings of fear, discomfort, anxiety in children and their parents. And the last thing we want is for a child or their family to feel anything but safe and secure within their childcare facility. Some children, as well as adults, are fearful of animals, and as Peter suggests, it's essential at all times to be conscious of the well-being and safety of both the children and the animals in the service. We need to respect the rights of children and their parents who may exhibit fear or anxiety and allow them some control over their interactions with animals. Having a permanent pet within the facility may cause considerable discomfort. The risk of injury due to interactions with animals, even when supervised, raises concerns as well. Young children often don't understand that they're hurting or frightening an animal, which can result in a normally placid pet reacting aggressively in fear or pain. Scratches, bites, and puncture wounds can lead to serious and harmful infections. Ultimately, it should be the family's choice when and where to expose their child to animals. And finally, the last argument I have to support the against position is disease. The primary concern in caring for or inviting a pet into a childcare facility is the risk of infection and disease that can be transmitted from animal to human. In a clinical report written for the American Academy of Pediatrics, these infections are explained further. Zoonotic diseases, or zoonoses, are infections transmitted between other vertebrate animals and humans. Most emerging infectious diseases in humans are zoonotic in origin. Many common pets and animals that may be of appeal to visit or reside in a childcare facility can spread these types of diseases. Household pets such as cats, dogs, turtles, ornamental fish, baby chicks, gerbils, frogs, and lizards have all been associated with outbreaks of zoonotic disease in the United States and Canada. More information and awareness is essentially required. Public health agencies, as well as the pet industry, need to provide public information on handling of pets and the risks of acquiring illness, particularly among children less than 5 years of age. The elderly, pregnant women, and the immunocompromised are of concern as well. Public health policies are also necessary in a number of high-risk settings to decrease the risks of disease transmission associated with pets. And these settings include, but are not limited to, day nurseries, schools, and rehabilitation and long-term care facilities. As a high-risk setting, a child care facility faces significant challenge to ensure the safety of the children in avoiding the transmission of infection and disease. The Canadian Pediatric Society, as well as the Ministry of Health and Long-Term Care, list a whole host of diseases that can be spread from animals to people that fall under the umbrella of zoonotic disease, leading to potential illnesses that include a range of symptoms and conditions, such as skin rashes and reactions, diarrhea, vomiting, bowel or intestinal disease, fever, shortness of breath, and other respiratory issues. Some of these conditions can be particularly problematic for children and elderly persons with weakened immune systems, but most alarming is that in some instances, these diseases can be fatal. All right, my rebuttal statement to support the against stance. Are there benefits to having animals visit or caring for a pet in your childcare facility? Of course, but these benefits can be achieved in other ways. Having a pet is not appropriate for every childcare service. If your service does not want to get a pet, then there are other interesting ways to introduce animals to children, such as visits to a local farm or a trip to a butterfly conservatory, things of that nature. These experiences lend themselves well to many other overall benefits to children as well. While the for stance certainly outlines numerous benefits to the inclusions of pets and animals in early childhood settings, the against stance remains firm. The risk is just too significant. The complex organization and consideration involved to successfully include a pet within a program is incredibly detailed and cannot guarantee that all risk will be eliminated. Why take the chance?
This is my rebuttal. When we take into consideration all the developmental benefits derived from a classroom pet, combined with educators and parents working together, having policies and procedures in place to mitigate any risks, and acknowledging our ethical responsibility, the children's classroom can be a highly rewarding experience. According to statistics, 53% of Canadian households with children under 2 years of age own pets in 2013, and 70% of Canadian households with preschoolers ages 3 to 5 own pets that year. These numbers substantiate the fact that families value animal companionship. While the against stance highlights the potential illnesses and diseases attributable to pets in the early childhood setting, the evidence is still inconclusive. It is a tremendous responsibility to ensure children's safety in early childhood programs, but it is not an insurmountable one. Dismissing the value added simply due to manageable legislation and clerical undertaking cannot be justified. By supporting suitable pets in the early childhood environment, all children are inclusive of these benefits, in particular those children that have no exposure to pets in their home environment.
When considering having a pet in your early childhood setting, one thing is certain. Careful consideration and deliberation must be undertaken in order to assess whether or not your program is able to support an experience of this nature. If the decision is made to welcome a pet into your child care program, necessary and extensive preparation will need to be considered in order to avoid the potential risks involved. With a committed staff dedicated to the success of having a pet live or visit the program, the benefits of learning to care for an animal can contribute to a number of developmental areas and have a positive, lasting effects on a child's overall well-being.